All right, we are going live. Welcome to my favorite day of the week. This is Monday Motivation here at ReMar Review. It's Monday. We do this little thing called How to Pass NCLEX, and it is one of the most beneficial things this community has. We're going to be talking about NCLEX questions. Yes, we come together to study. And we'll be studying med-surg questions, which you guys know can encompass really anything. And so today I'm bringing the heat. And if you have that comprehension that you need to pass this test, it's all about getting your license this year. Come on in. Hi, everybody. I'm live. You caught me live. Yes. Our motivation will be your condition, and we'll look at your condition, exactly what it is. Hey, I cannot forget the one and only, somebody sent me a message, said thank you to the one and only NCLEX virtual trainer. That's where we're bringing all of our nursing content for RNs and PNs today. It's coming from the VT. All right. Lots of great reviews coming out of the virtual trainer. If you don't have it, you can still grab it at an amazing discount. Get your VT. Get it at remarnurse.com. You know, that's my website. It's where I put all of my information, all of my classes, lectures, everything. The price for the virtual trainer is a fabulous, just $189. You get 55% off of it right now. And our community is growing. We have over 8,000 nurses. So we're moving right along, moving right along to our 10,000 strong community. It's coming. I love it. I'll be talking about that. So stick around. All right. Yes. So our community is growing. We have nurses passing NCLEX. You know, the goal was 10,000. So the way we get there is by coming together and studying. So our first NCLEX question, are you ready? It's coming up. It's time. Number one question right here is, a newborn client is admitted with a diagnosis of pertussis after a 3-day history of paroxysmal coughing and nasal congestion. Which intervention does the nurse expect? Select all that apply. Number one, monitor vital signs every hour. 2, administer antibiotics. 3, monitor for apnea spells. 4, evaluate the white blood cell count. 5, maintain airborne transmission precautions. Okay. And I see your questions coming in about the VT and everything else. I will be answering them at the end. Okay. All right. So here we have the condition. We have the scenario. This is a select all that apply. Okay. So what is the priority here? What interventions should the nurse expect? All right. Here we go. All right. Now, I see 3, I see 4, I see 5. Okay. We have the patient with paroxysmal coughing and nasal congestion. What do we need to do for this? Newborn? Newborn care. Gotta know it. All right. And this is a select all that applies. So that means one or more answers can be correct. One or more answers can be correct. All right. Here we go. I'm going to reveal the answers right now. Here they are. Pow. Yes. 1, 2, 3, and 4. 1, 2, 3, and 4. All right. So let's go over them. Let's review it. A lot of people did not pick 4 for whatever reason. A lot of people didn't pick 4. But there's indications that should have been included. All right. So monitoring the vital signs, absolutely every hour. We need to do that as part of an intervention that you expect. And as you guys can see, I'm going to go back to the answers, but as you can see, I am really focusing on the NCLEX's clinical judgment model. So I am writing my questions based off of the interventions that you guys are expected to know when you get into the Q Bank. My assessment is based off of the clinical judgment model that NCBSN is using now. And so if you're not familiar with that, you need to familiarize yourself with the way they are interpreting clinical judgment, because it is important. And so as part of it, you have to be able to anticipate interventions. Okay. You have to be able to recognize cues. All right. So monitoring the vital signs every hour, of course, that's appropriate intervention. 2, administering antibiotics. Okay. So, that is something that would be expected. That is an intervention that would be expected. All right. Monitor for apnea spells. All right. So you guys know that infants typically are predisposed to having apnea, especially when you have the coughing, the paroxysmal coughing. And so we have to be able, based off of our client's symptoms, to anticipate complications they may have, diagnosis, and all these things. All right. So, and then also the white blood cell count is going to reflect any source of infection that may be present in the patient, right? So the white blood cell count is very important because we need to monitor, is there active infection going on in this newborn? Shout out to the people who are coming on here saying, I passed NCLEX. We're so happy to get that report back from you. 5 is not correct. A couple people did pick 5. And it may have been because of the coughing. Maybe we thought it was respiratory, but indeed it is droplet. It is droplet precautions here. Okay. All right. Yeah. Come on in, get settled in. We're just talking about NCLEX. You will get used to this voice. I promise you. All right, here we go. Question number 2, we are moving on. All right. A nurse administers 2 milligrams of morphine IV. All right. To a client at 400 hour. Okay. So 4 a.m. for a reported pain of 6 out of 10. When does the nurse reassess the client's pain rating? Oh, yes. Is number 1, 5 a.m., 2, number 2 is 6 a.m., 3 is 5:30, or 4 is 4:30? Come on in, Jessica. I like that answer there that you gave me. Bring your answers in. Okay, here we go. Okay, here we go. Now. I am looking for a reassessment time for a pain medication. And I don't want to give it away too much because I think you guys kind of have this when I see the answers coming in. But it is always important to know the way a medication is given, because then you will know, okay, how long does the action take? That's the key here. Do you know how long it takes for an IV medication to become effective? All right. This is content. This is not strategies. This is content. All right. Answers is coming in too quickly. You guys are really confident about this one. So I shall reveal it. It is indeed number 4. All right. Number 4. So IV pain medications, they work quickly, right? 15 to 30 minutes for a peak. That means when the medication is at its most effective. So we would reevaluate the pain at that time. All of the other answers are going to be too long to wait to really evaluate the client's pain. Now you can come back at 6 and ask them, has your pain resolved? And they'll say yes. And some nurses do. in real life, you get busy, you give a medication at 4, you don't come back until 5 or whatever. But for your state board exams, you guys know it has to be perfect and it has to be right on time. So for that reason, you're going to get back there in half an hour to reevaluate that pain. Okay. All right. Good job, guys. You guys are doing fantastic on this Monday. This is How to Pass NCLEX Live. Next question, another select all that apply. Yes, we are doing select. The nurse first stops the infusion. The nurse takes which additional actions? Select all that apply. Select all that apply. Number 1, apply a cold compress to the site. 2, remove the IV line. 3, contact the healthcare provider. 4, elevate the limb affected by infiltration. Or 5, document a description of the site. Now, this is very good because it is select all that apply. So I will tell you for sure, there is more than one answer correct here. But with the select all that apply, okay, with the select all that apply, you know, if you pick one wrong, the entire thing is wrong. The entire thing is wrong. All right. So you have to pick exactly the correct answer. Exactly the correct answer. All right. So let's hear it. Let us hear it. What do you guys say it is? 2, 3, 4, and 5. I see that a lot. All of them. Fred thinks it's all of them. Okay. Most people are saying, I'm going to do everything here. I'm going to do everything here. Okay. All right. And this is why we come. This is why we come. We're going to have to break this question down to, I see 2, 4, and 5. Come on in. We're studying. This is what we do for NCLEX. We prepare, we discuss, we prepare. This is the largest study group anywhere on the planet, and you made it here. Shout out to you. Persistence. All right. Okay. So I know. And I'm going to address. Okay. So I'm going to just show the answer because you guys are, you're asking questions now. You're going back and forth. All right. Here's the answers, guys. Pow. Oh, yes. 2, 4, and 5 is correct. Shout out to everybody that saw number 1 and was like, that compress should be warm, not cold. We're not going to do that to the patient with infiltration. We are not going to do that. But let me go back to the stem of the question because you learn a lot here. So you have an IV infiltration. Number 1, do you know what that is? Okay. What does it mean if a vein has been infiltrated? What does it mean if a vein has phlebitis? Okay. These are terms that you have to know, very basic terms in nursing care. But you have an IV infiltration from what? Is it a medication? Is it a harmful, deadly medication? Is it a wrong medication? These are things that are important to ask yourself. All right. Before we even get to the choices. No, it's not. It's an IV fluid. And it is a normal saline. Okay. So if we have infiltration from normal saline, are we going to expect the patient to have a reaction of some sort? Is this a medical emergency? Do we expect the tissues from an IV infiltration of normal saline? All right, let's think about that because that will help you to think about what other interventions must happen. So right now, we're just talking about IV infiltration, normal saline. So number 1 says apply a cold compress. So no, we're not going to do that. Okay, we will be looking for a warm compress. 2 says remove the IV line. Absolutely. Absolutely, we're going to do that. We need a new site, period. Okay. 3, contact the healthcare provider. So many people picked that. So many people picked contact the healthcare provider. All right. I would not do that. Okay. Why would I not do that? Why would I not call the doctor up and say, hey, my patient, I went in there, the IV was infiltrated, and I'm calling to tell you that it was infiltrated. What is that doctor going to say? And what else? What else is going on that you've called me from another patient? You've called me from, surgery or writing orders, or why have you called me for normal saline infiltration? Okay. These are because remember, anytime we call the doctor, we have to communicate the situation. And so very rarely is calling the doctor appropriate if you haven't done something. Okay. And so when I was doing NCLEX questions and I was writing them for the assessment portion last night for the Q Bank, I was writing questions like these to get you guys to really think before calling the physician, because if you read your nursing reference books, it'll say a nurse is immature if she calls the doctor too soon. It'll say her knowledge is immature. And so I don't want us to be considered immature. I don't want us to be considered immature in our knowledge. So we would not call the healthcare provider for this instance. And I'm dwelling on it a lot because a lot of people picked, I would do everything. I would do all of them, right? Tay says, you're calling him 3 a.m. about something that's not an emergency. Yeah, something you can handle yourself. So we don't notify the doctor in this situation. And so you guys can see the times we don't call the doctor are many in nursing. It is an independent profession in a lot of ways, All right. 4 was correct. I'm just going to move on. 4 was correct. We would elevate the limbs elevate the limb of the infected infiltration, right? So it's elevation for comfort, kind of help resolve that fluid. And then, of course, document what you have seen. All right. So this was a tricky one. But this is why we love select all that apply questions, because they really get us to evaluate it. Okay. Evaluate it. So here we go. Yes. The doctor saying, and I like that. All right. Let's move on to the next question here. Are you guys ready for it? Okay, here we go. A client with osteoporosis takes multiple oral medications. The nurse recognizes that what medication, if taken by the client, may further decrease bone density. Okay, pharmacy, here we go. Is it acetaminophen, ibuprofen, prednisone, or resindronate? Okay, what medication are we going to suspect may decrease bone density? And remember, guys, some of you guys just know, like, I'm just getting these wrong because I'm not really reading them correctly. And so that's something we're working on as well. We're working on slowing down and reading them. So this question is pharmacology. We got bone density concerns. Okay. Bone density concerns here. All right. All right. So here we go. The correct answer. All right, family. I got a mix between 2 and 3. So nobody's picking 1 and nobody's picking 4. Does anybody know what 4 is for? I'm not going to tell you. Are you familiar with this? I'm not going to tell you what it is. Does anybody know? Does anybody know what this is for? All right, I hope so. It's in quick facts. Here we go. The correct answer is going to be prednisone. Yes. Long-term use of prednisone is associated with lowering the bone density. right? Lowering the bone density. Hey, if you're just starting nursing school, I appreciate you being here. You're going to learn a lot. All right. So this is a pharmacology question, knowing the major side effects of very common medications. You don't need to know the specific details. Nursing students, please do not be studying dosages, things like that, because remember, the doctor, the pharmacist, they will do that. But we definitely need to know. Let's keep it simple with our pharmacology and keep it consistent. All right, question coming up here. Oh, this is a good one. We're going to change it up a little bit and talk about this. Which behavior in a client recovering from a major depressive episode would the nurse judge as an improvement in the client's condition? Okay. You know what we're talking about? We're talking about a major depressive episode. Okay. So what would indicate your client is improving? Okay. Number 1 says the client states he's ready to go home. 2, the client invites others to sit with him at lunch. 3, the client spends time quietly looking out the window. Or 4, the client has fewer episodes of emotional outbursts. Oh, I'm looking for the one that says that my client is getting better. I'm looking for the one that says my client is getting better. And so this is clinical judgment, picking up on cues. You guys got to know, to pass NCLEX, you got to be right on it with the clinical judgment. You got to know what is normal, what is expected, what is to be evaluated. Okay? All right, this is your license. This is your time. This is your product. You are the CEO of your own company. It's called Nursing License, Registered or Practical Nurse, but it's yours. All right. And yes, these questions they're very likely to be seen on NCLEX because they are content focused. All right. Major depressive episodes. Here we go. The correct answer. I love it. I love it. It is number 2. You guys got that thing. Yes. Easy. Clients who are severely depressed are usually slow moving and withdrawn from others. They don't want to be social. They don't want to talk. They don't want to get out of bed. They don't want to go to the community room. And so if we see a client interacting with other people, then that is definitely a sign that their depression is resolving a bit. They're seeking out. Did you get that one right? If you got that one right, shout out to you. It's that they're seeking out social activities. This is a great thing for us. All right. A client saying that he's ready to go home doesn't tell you anything about his depressive disorder. You just could be tired of being there, right? Looking quietly out the window is an activity that you do solo. You do it by yourself. So that could be part of the depressive disorder. And then you guys know we don't typically see emotional outbursts from patients who have major depressive disorders. Like when you think about depression, the patient is usually down, right? And they consistently stay down. So there's not an emotional outburst that you would see with mania or bipolar disorder where you have the extremes, right? So this condition is pretty straightforward if you're just looking at one side, okay? The negative side, which is depression. All right. So how did you guys do today? All right. How did you guys do today? I think if you got a 3 out of 5 today, you indeed had a very motivating Monday. And I'll give you guys one. You probably missed one because of, number 1, there was a lot of select all that apply questions today. And a lot of people did not read that infiltration question correctly. And so you didn't realize that it was normal saline that was infiltrated. And you just kind of saw infiltration as a big thing. Okay. All right. So This is what we do every Monday. We come together, we study, make sure you don't miss it, but we have more because there is more to learn. I hope you have your NCLEX virtual trainer. Again, right now, if you don't have it, somebody said, what is it? What is the VT? So just really quickly, the virtual trainer is my online program platform. Put up how much you love the virtual trainer if you have it. There's some people watching it. So what it is it is an online platform where you go in and you can watch a full NCLEX review given by myself and only myself. There won't be like any mysterious teachers or anything like that you don't know. It's me giving you the information that you need to pass NCLEX. Also, what makes it great is that it comes with books for you to write in and study. Your student workbook, your quick facts book, they come as part of the package. And then you also get examples of this wonderful community here that we have through discussion boards. You have file vaults. The virtual trainer is the best resource out there. Somebody says, I have VT. I love VT. It is the best resource out there. And it's the newest product that I've created. So you may not be familiar with it. Just the term virtual trainer, people who have it, they begin to call it the VT, right? And so this is the newest way for you to study for your NCLEX exam here. And I'm so excited to share it with you guys. I'll get more back into the VT. Diamond says, I love the VT. I purchased it 2 weeks ago. I'll get more back into the VT, but we are, okay, we are moving on. And I got to get serious. I got to get serious here because now before I do this, I have to tell you about Nurse Nan. All right. She was a repeat test taker. And I love this. She was a repeat test taker. Let me tell you her story. You see her here. Happy, happy, happy. She says, to God be the glory. I can finally say I'm a ReMar nurse after 18 years out of school as an international nurse and a 3-time repeat test taker. I can't even believe it. She only looks 18. She says she's been out of school for 18 years. It just blows my mind. So she says, thank you, ReMar family, for everything. And God bless you all. So what excuses are you having? What is your condition? Here? Because this is insane, right? We also have another new ReMar nurse. And here's her story. This is Nurse Beatrice, and she says, good morning, Regina and ReMar team. All right. I took my NCLEX this past Thursday, and yesterday I got my results. I passed my NCLEX RN. I am so happy thanks to Regina. Okay. So I'm a nurse from France. So we shout out international nurses. She said, I'm a nurse from France, worked 7 years over there and moved to Florida. Okay. 3 years ago. I felt once the NCLEX RN, I was just not ready. But this time I used the VT and the book. Okay. She says, your content is just so great. I got to refresh on everything and was ready to get back on track. Thank you so much. God bless you. All right. Awesome. All right. So listen. What we're finding with the virtual trainer is that most of the students who purchase it, who are repeat test takers, they used previously UWorld and Saunders. Okay, they used previously UWorld and Saunders. And so if you are studying with those products and you feel like you need content, you feel like you need it to be put together, please consider the virtual trainer. All right. And not even please consider it, but you got to do it, because when you see stories like Nurse Nan, who's been out of school for 18 years, Nurse Beatrice, she 7 years in France, came over here. Amazing. All right. And so one of the things that I want to say is I have a lot of people, when we get to this time of year, there is a lot of us who are just waiting to test. We literally have our test dates scheduled. and we're just basically waiting to test. I talked to a student yesterday, and she has a test date coming up, and she said, I studied. I'm just nervous now. I'm just nervous. And so I had to encourage her and remind her that your test date is not a surprise. It's not something that just happens to you out of the blue. You guys know when your test is coming. So it's not something that you're afraid of. It's an opportunity that you are ready and wanting to take. And so we have to keep that mindset, because there's nothing more valuable than your nursing license. All right. So the NCLEX motivation actually is your condition. That's what it is. It's your condition today. That's what I'm going to focus on. And so I'm coming from scripture. All right. And you guys know my background. So I get a lot of inspiration from the Bible for my life. And then I really think this will apply to you guys, because it just made me think of my students who are testing. So it comes from Luke chapter 8, verse 43. And it simply says, and a woman having an issue of blood 12 years, which had spent her living on physicians, neither could be healed of any, right? And so this is a presentation of a woman in the Bible, and she's not even given a name. Like, how she's introduced to us is just her condition. It literally is just her problem. It's like, okay, here's a woman and she has this bleeding issue. She had a hemorrhaging issue. And it says she spent her entire living, all of her money, trying to fix this problem, right? So it's just this mystery woman, right? And all we know about her is her problem. And for me, this is like the identity that some of us take on when it comes to preparing for NCLEX. We don't see ourselves as nurses. We call ourselves, I failed NCLEX. When you guys send me an email, you introduce yourself as saying, I don't understand content, or I struggle with NCLEX, or I failed 10 times. Don't tell anybody. So it's like we identify ourselves by our condition. And so when I saw it yesterday, I'm like, man, this is going to speak to so many people, because I want us to stop doing that. I want us to see ourselves not as the condition. Okay. We are not people who have failed NCLEX. All right. And so anyways, with this woman, which makes her story so incredible to me, is that it says, even though she had this condition, she had faith. And so she heard that Jesus was coming. She heard that he could fix all problems. She heard that he was doing miracles. And that's literally what she needed. She needed a miracle. So she came up behind Jesus and touched the fringe of his cloak, and immediately her bleeding stopped. And Jesus said, who touched me? Right? But everybody around, they all denied it. Master, said Peter, the people are crowding and pressing against you. But Jesus declared, someone touched me, for I know that power has gone out of me. Okay. And then the woman, seeing that she could not escape notice, came trembling and fell down before him. Okay. In the presence of all the people, she explained why she had touched him and how she had been healed. So Jesus' response to her is, daughter, your faith has healed you. Go in peace. And so this story, and this is the very abbreviated version, if you know this story, is that the woman, she came into the city even though she was considered unclean. Back in that day, if you were bleeding, if you were hemorrhaging, you were not to be amongst people. You were supposed to be isolated. You were supposed to be set alone from contaminating everybody else. So this woman actually took a chance by coming into the presence of people. They could have stoned her. You know what I mean? They could have killed her for disobeying the health laws, for disobeying it, right? And so she stepped out with courage. She stepped out with faith, knowing her condition, right? But seeing an opportunity for a change, seeing an opportunity to be different after this encounter. And so I really wanted us to embrace that, right? Your condition will not be your conclusion. How you are now is not how you will end up. And we have stories, we have testimonials of real people who have already walked this walk of faith, because that's what you need to have. You need to have faith that something better is coming for you. If you don't believe it, I can't believe it for you, right? But what we can do is we can find inspiration in people who have gone before us. And so I love this story of this lady because she did not let her current situation affect her future. All right. Affect her future. And so I don't want that to happen to you guys. So that's our motivation today. Yes, 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 yes. And then imagine, what I love about it is just imagine, because we don't see her end story, right? But just imagine her testimonial, right? After she had been healed, going to every doctor, spending all of her money, but got a free healing simply based off her faith. And so you guys show up every week after week for these free classes, right? And it's an opportunity for you to exercise your faith, all right? Because it really, when it comes down to it and you're in that exam, you are scared, right? You need something else to be your solid rock. You need something else to stand on, right? To pull you through the nerves, pull you through the anxiety. And I found that, yes, you can prepare. You can prepare and prepare and prepare, but having a peace that passes all understanding, man, that will take you longer and further than anything that you can do on your own. So that's our Monday motivation. Again, your condition will not be your conclusion. Okay. Your condition will not be your conclusion. Have faith. All right. So, now I will be taking your questions. I know you guys had a lot of questions about the question bank, and you guys know I'm just going to do my little presentation about the question bank, and hopefully it will answer some of your questions that you may have about it. So the question bank that I will be coming out with, again, for the RN and PN, it will be a subscription-based program. All right. So that means that you will get 30-day access, 60-day access, or 90-day access, and you can choose which access you want. The prices are there. As you can see, the prices to the question bank are extremely reasonable. Okay. Extremely reasonable for what you're getting. And the RN and the PN will both have 1,200 questions in the pool. And we're going to be adding questions to it every day. But right now, this is the amount that we have that we're starting off with for entry. Yes, it will be available to VT users. All right. It's going to only be available to VT users in the beginning because, all right, we just have to be able to, we have to be able to take care of everybody that's going to get into this thing. There is one assessment for each access, no matter what you get, for 30 or 60. And this means that you'll get to take an exam that will give you like a prediction or, you know, things like that, how you're doing. Again, I was in it last night. So I'm really hoping that it will be tough and challenging. I made the questions to be very challenging. If you get the 90-day access, then you'll be allotted 2 assessments. And these assessments are 100 questions apiece. Okay. All right. Yes. So people are asking, what will it be like? A preview of it. So it is very similar to the question banks that are out there in terms of UWorld or Kaplan. there's other companies that also offer question banks, but the idea is that you can go in and pick the types of questions from based on subjects. Okay. So we have RN and PN again. Yes, there's rationale for every question. It'll tell you the answer, the right answer, the wrong answer. Yes, this is different from my question bank book. It's very different. The questions are all different, actually. And it will help you to increase your confidence for sure. However, you definitely need to do a content review before you do these questions. These questions are tough. And I am going to keep going through them, keep revising them. Another thing I did with the question bank is that at the end of every question, I put the reference from where I got the question from. So if it was a research paper or article, you guys will be able, or if it was a book, you guys will know what book we used for every question in the virtual trainer. In the virtual trainer question bank. Okay. And so now the question is just like, when is it? When can I get it? We will be, this will not be inside of the virtual trainer. It will be on another site. So we will be sending out the link for the virtual trainer, sign up people who have virtual trainer either now or in the past. Hopefully we will be sending them out before next week. Like this week is what we're praying for, what we're hoping for. And I know we've had many delays on the question bank, but at the last minute, we wanted it to function different, so I wanted you guys to be able to see how everybody else is doing. We wanted you guys to, be able to have assessments. And initially, I didn't have assessments with the 30-day package, but we wanted to be able to include the assessments for the 30-day package. And so my developer is probably just like, you guys keep wanting me to add things, but even though we're not going to raise the price, we want you to have all the features. I want this to be the only question bank that you guys need if you want to do more practice questions. All right. So what is the question? Does VT come with context? So VT comes with content. The question bank will only be questions. So for $30, you will get access to all 1,200 questions. And I think the RN has a little bit over 1,200, like maybe 1,250. So, yes. And somebody said, can you take us inside for a sneak peek? We will. Okay, we will. Mark said we will. All right, that's a whole different technological presentation. All right, but yes, I will definitely do that so you guys can see when it's ready what it is like. All right. Yes, I know people are acting weird. We're trying to block everybody that doesn't need to be here. All right. What other questions do you have about the question bank? Again, the pricing is there. So if you are looking forward to this, just please put $30 aside. Okay. $50 aside, whether you want the 60-day or the 30-day. Honestly, I think, I don't know. I think most people, I guess I would recommend the 30-day to start, to be honest, because I think that if you're finished with your virtual trainer, that you are able to go through this. Okay. That's a good question. Leela says, so the questions are different from the QBank and the virtual trainer. Yes, they are. They're different. These questions are totally different. Again, the questions are done. The only thing we're working on right now is just making sure that when 6,000, I'm probably expecting like 6,000 people to get into this question bank, that we don't have any issues. So we're waiting. As soon as the link is ready, I'm going to come on here. I'm hoping it'll be ready this week. All right. And so as soon as it's ready, just give me a couple more times. Just give me a couple more days. Okay. To get this out to you guys. But I'm really excited about it. This will be my newest product after the virtual trainer. All right. So this again is to be used with the QBank. Somebody says, I need content in QBank. Let me pass the NCLEX. Yeah, this is that 1-2 POW combination for sure. And so you start with the virtual trainer, and then you go into the question bank. Okay. So again, I will be sending out a link for this inside of the virtual trainer for everybody to have it. And then you guys will be able to purchase it. Okay. And like I said, I'm recommending everybody get the 30 days because what will happen is after the 30 days, your access will just cut off. And so if you need to renew it, you'll just purchase another 30 days. Okay. I want to thank you for fixing my issue. I did email and y'all worked it out. Perfect. Can you charge only one price for life? No, not lifetime access. No, not lifetime access. All right. Yeah, because I don't want you to have lifetime access. I want you to get your license. All right. If the VT is expired, you're still going to add? Yes. So if you have your VT and it expired, or you're finished with it, then we'll send you out an email as a past customer to say, hey, the question bank is ready if you want to purchase it. All right. If you want to purchase it. And then just my goal is that everybody that gets into it, I know we're going to have a flood of people that you guys are able to get in and start studying, and the rationales pop up and you're learning, you're having a good time, and all the exhibits work. Again, there's a ton of, I would say about 40% of the questions are select all that apply. Maybe even more than that. There's exhibit questions in here. Fill in the blank. There is a math section that's all math, clinical calculations, dosage calculations as well, pharmacology. I mean, just whatever subjects, mental health, pediatrics, critical care if you're RN. The PNs don't have critical care, management of care, coordinated care. So this is absolutely going to be a plus and a huge resource to those of you who finish the virtual trainer and just want more questions. There are questions in the virtual trainer, but people always, just like to do questions. And so I don't want you guys to have to pay too much for questions. I think UWorld's questions right now are $100. Is that for 30 days? $129 for 30 days for UWorld. And so that to me is outrageous. And I don't even think you get an assessment with that. And so I wanted to do something totally different. I wanted you guys to be able to have a different experience. So we're going to start it off with 30 days. That's $1 a day. All right. Yes, these questions are going to be very similar to what's on NCLEX. These questions are going to be tough. Oh, goodness. Okay. And then they're going to be practical too. And so I have I have a balance of tough questions, but you have a section of fundamentals. And I'm literally in the fundamentals question asking you basic things. Like some of you are asking me, what is evisceration? Like, what is phlebitis? Okay. So this is a separate product. This is not the virtual trainer. It is something completely different. It's a different website. So it's a different product. Okay. What is the best way to integrate the pediatric quick facts with VT? So pediatric quick facts is a supplemental resource, which I will be adding a lot of information to the virtual trainer in terms of supplemental things. So you go through the virtual trainer. I have my NCLEX review for pediatrics in the VT, right? So we go over infant heart defects, we go over developmental milestones, all of those things, right? So that is what you need to know based on the test plan. However, I'm having nursing students who are entering into the virtual trainer while they're still in nursing school. And so they are wanting more information. They need more help in their pediatric courses. And so I actually created the pediatric quick facts for a class of nursing students. And so because I gave it to them, I wanted to just make it available for everybody. So focus on if you're NCLEX prepping, focus on your NCLEX review in virtual trainer. All right. And then if you have time, no one wants to. Okay. And if you have time, then you can look at the other supplemental resources, because I'm going to be adding a lot of supplemental things in there for the nursing students that enter into the virtual trainer. Okay. The $69 is monthly access. It's a monthly access to the virtual trainer. All right. Because with the virtual trainer, you get 3 months of the initial subscription. And then after that, if you want to stay in the VT longer than that, then you are renewing your access every 30 days to the virtual trainer. Okay. So, unless you cancel it, and you can cancel it, right? You can cancel it at any time on your own. You don't need Team ReMar to do that. But the idea is that you get in and you get out of the virtual trainer. Okay. Just graduated in the VT and quick facts for my exit exams. I want to know if that's okay. Yeah, perfect. Okay. That's correct. Okay. ReMar does okay. So UWorld is expensive, but I love their rationales. I like that they explain why the other answers are not right. ReMar does your bank explain? Yes, yes, it will. It will absolutely explain it. And for my rationales for my question bank, I did not make them very lengthy. The idea when you're doing NCLEX questions is it's not a review of content, right? So there's a difference. So when you're doing NCLEX questions, if the rationales, in my opinion, are overdeveloped, then sometimes it causes confusion. It causes an overwhelming feeling, and you leave not really taking away the major point. So with my rationale, it's very simple. It's like, this is the answer. This is why this is the answer. I try to do it in less than 4 sentences. And then I look at option 1, 2, 3, 4, and I say in a sentence or 2 why those were not the right answers. And then I give you the reference at the bottom. Okay. If you have the question bank book, do you suggest getting the question bank? Okay. So that's a good question. The question bank book is a physical book. Do we have any more? Or are they all sold out?
We have more PNs, RNs are open.
Okay, so the RNs are sold out, but we actually have a physical book of questions, right? And so the book of questions is very great, right? It's there. The rationales are in the back of the book. However, the questions you can't choose what you're doing. Right. So if you feel like, okay, I did the question bank book, but I really would like to do more math, or I didn't get enough mental health, or I need to review med surge, then you might want to look into the question bank. Okay. Will the VT be going on sale for the 4th of July? No, I'm not doing anything for the 4th of July. I'm not celebrating the 4th of July this year in any way at all. Okay. It is on sale. It is on sale. Okay. So, all right. So anything else? Yeah, that I won't. This year, I'm not celebrating the 4th of July. I just cannot. It is just not the independence that I'm celebrating. Okay. Is it realistic to use the material now and be prepared for July 17th, 2020? Or do you recommend more time to prepare? What is it now? It's June?
It's about 3 weeks.
3 weeks away. Ooh.
It's close, but
okay. It is kind of close. It is, but it is true. It has been done. I think if you're consistent with your studying and you only have 3 weeks to go, I think you can get through the virtual trainer. But let me tell you something about the virtual trainer. The virtual trainer is a challenge. It is a challenge to most students. And I get a lot of emails where students are saying, tell me the answers, just tell me the answers, right? So if you are looking for a review program that's going to tell you the answers instead of make you demonstrate them, then 3 weeks is going to be very challenging. But if you are up for, okay, I need to evaluate myself, I need to critically think, I need to repeat activities, then the virtual trainer is for you. I think people are finding success because it motivates them. The virtual trainer is either going to call your bluff and you're going to say, quit, I don't want to do this anymore. Or you're going to say, you are not going to beat me. You are not going to, am I right about this? You're not going to take me out of the game, right? Daryl says it's about being disciplined big time. Exactly. So the virtual trainer, it calls your bluff. So if you have 3 weeks before you test, but you're down, you're ready to grind, you're not prepared, I think you'll know right away once you get into the virtual trainer if you are prepared for the exam or not by the time you get to that first test. And so that will give you time to change it if you need to. Okay. Okay. Let's see. You can cancel it whenever you want to. Yes, you can cancel it. The question bank book is everything. If you want to get the virtual trainer or the PN practical nurse question bank book, you can get that on the website remarnurse.com. That's still available. The RN question bank book is sold out. We did a sale last week and it just didn't last. Okay. April, as a nursing student, I really appreciate you. Thank you. Can you do a physical Q bank book with 1,200 questions? What? Students would prefer that. I don't think so. I honestly don't think so. I don't think students would prefer a physical book because I have international students. I have students who when they want to do their questions with a question bank book. It's really, it'll be more pricey. You'll have to pay for shipping. You'll be looking for wait times. So the online question bank is the way to go. It's the way to go. Okay. Okay. I cannot. Okay. So I know there are people coming on soliciting on the platform. That's the new thing now. And that's what I can tell you guys. Be very careful. Okay. Be very careful for people who are offering to sell you NCLEX questions, for people who say, jump on somebody else's platform to say, I help with NCLEX. If you help with NCLEX, then you should have your own channel, your own website, your own audience. So I've seen so many people lately get scammed. All right. So please be very careful of that. Oh yeah, can you upload your baby shower Amazon list in your PO box so we can buy you stuff? Okay. So again, I will be doing another free review coming up for my maternity. It'll be my last event, my NCLEX review. It will be maternity. I know I was saying I was going to do a virtual baby shower. I was going to do a lot of different topics, but it will definitely be maternity. Okay, it will definitely be maternity-based pediatrics questions. And it's on the Facebook page of events. All right, as well. All right, any questions? Can I pause the VT to take notes? Absolutely. Absolutely. You can pause the VT to take notes for sure. You can also slow it down. You can also run it back. Okay. All right. Listen, if your test is coming up, stop looking for things to do. All right. If you've done everything you can, all right. If you've done everything you can, then this is your opportunity to test. You don't have to be busy up until the last moment, right? You get to a place where you have the products, you studied them, and then you realize, hey, I have done all I can to prepare. Okay. Am I going to print out more of the RN test bank books? No, I probably won't. We're going to transition strictly to the online. We're going to transition strictly to the online. Someone asked how we can integrate the pediatric. I spoke about that. Okay. For repeat test takers, is the virtual trainer a good resource to use for someone who graduated school years ago? Absolutely. Absolutely. And how do I know? Because I don't know if you just came in lately, but we had this lovely young lady, been out of school 18 years, took the exam 3 times, So what is your excuse? 6 years, 4 years, none of those things should discourage you from the ability to pass this test. Okay. I cannot say that enough. This is an exam that you can pass no matter what. Okay. Virtual trainer does have captions. And I don't know how long she studied for. Okay. I don't really know how long she studies for. She didn't say, but, you guys know how it doesn't matter how long somebody else studied for. You know where your starting point is. Everybody starts at a different place. And so for somebody that's been out of school 18 years, she may have really had to take her time and break down every little thing. All right. Where you haven't been out of school that long. Most of that stuff is right in the middle of your brain. You got to just bring it up to the front. Right. So that's it. So that's it. It's just finding out where you need to start from and getting there. Okay. Do what works for you. Okay. Pace. Okay. So I am, you already poet? Oh, okay. Yeah. Okay. So I am, let me see. I've taken 4 times, graduated in 2011. All right. Thank you, Regina. Use my ReMar stuff I purchased 2 years ago, or should I repurchase it? I would say the virtual trainer, honestly, is the way to go. The virtual trainer is the way to go. I just put up a link. It's a very long link to the events. If you guys haven't signed up, that's a terrible link. But I put up the link to the NCLEX virtual baby shower if you haven't, and the registry. So if you haven't signed up for it, you can do that. All right. And then, so my goal for that event is to make sure that I just go over maternity questions. We're going to give prizes, giveaways. Hopefully I can give away some question banks and things like that. Okay, let me see. Okay. All right. Yes, the pharmacology review, ReMar Nurse University was a great time. We are working to put that into the virtual trainer. Okay, we're working to put that into the virtual trainer for you guys. Can you explain how you would prefer us to use the VT for studying? Okay, so that is another great question. I want to start by saying this. For the virtual trainer, there is a video that I did on YouTube explaining how you should be using the virtual trainer. Okay, so if you are familiar with the YouTube channel, please look that video up. It's about 45 minutes. I go really into detail. However, just on a day-to-day basis, what you need to do for your virtual trainer is go to your file vault. Everybody that has a VT has a file vault. Inside of your file vault, you will find NCLEX resources. Okay. Underneath your NCLEX resources is your calendar. I have a 6-week calendar for RNs and PNs. Now, I'm only saying it's a 6-week calendar because that's how I structured it out. But you can look at the days. I have you studying, I think, 3 days a week, 4 days a week for 6 weeks. You can take any number of days and put them in a week. So even though I have you studying 3 or 4 days a week, if you want to study 5 days a week or 6 days a week, you can do that. But what I want you to see is how much you should be doing a day. Okay? How much you should be doing a day, because it can be overwhelming if you try to do 7 sections of the virtual trainer in one day. Okay. It is very overwhelming to do that. So I want you to look at that calendar that I created, not because I spent a lot of time on it, not because it was very difficult to do, but I want you to look at it to give you a skeleton of how you should be studying every day. One of the problems that nursing students have is that they don't know when to quit. Okay. And I think when we see people who say, yeah, I got through the virtual trainer in a week, or I got my license in 3 weeks, that's what we want. But we may not all start at the same place. Okay. All right. I don't know why I can't put this in here. It's just not letting me. Okay. Yeah, I was trying to put the link in YouTube.
Just say put it in the description. I'll put it back.
Oh, okay.
Link is in the description.
Okay, link is in the description. I don't think there's a third option. The VT is the learning tool. Okay. All right. Oh, I see why it's too long. Okay. 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 All right. I didn't have a chance to. Okay, yeah. So, so some people are like, I use the DVD program in QuickFox. I didn't even pass. I didn't have a chance to use the VT. I didn't have a chance to use it. Exactly. And so what I'm saying is that really, guys, if you focus in on the content, the questions will come. You'll be able to understand them. You'll be able to learn them, and you can get rid of some of the anxiety. Some of you guys have anxiety you don't need to have because you actually have been preparing every day. And if you want to stay motivated, if you want to stay engaged, we have so much stuff on YouTube. We have so many events that you can just go back through and listen through. Okay. No, the calendar is not available through the YouTube channel. You actually have to have the virtual trainer to get it. Okay. Hi guys. I passed my NCLEX. It took me 5 weeks to finish the VT book. So there you go. Okay. Everybody's different. Okay. VT will show you everything you have forgotten. Yes. Okay. And so my email address, please email support@ReMar Review. A lot of people are emailing the old email address, and it's not, we don't have staff to check that. Okay. Okay, guys. So thank you so much. Okay. Thank you guys so much for everything. If there is no more questions, then I am going to cut the live. All right. I think I did it here. Let me see here. Okay. So that is the event. Everybody on YouTube, if you click on that event, that is to sign up for the NCLEX review for the virtual baby shower. And also you can see the registry on there too. Okay. Laverne is testing tomorrow. I am so happy for you. I'm so happy for you with your test date. I have some students testing on the 1st already. And so it's just crazy. All right. Okay. For your state boards, you have to, you're going to have to look at what refresher courses they require. Okay. How do I get the question bank? I already have the VT. We'll be sending out a link. No, I won't be doing final time. No, I won't be doing a July 4th sale. I won't be doing a July 4th sale this year. Okay. My goal is just to have the question bank out to you guys by then. And so if I can get that done, I'm happy with that. Okay. The virtual trainer is still on a discounted price. It's still on a very good discounted price. Okay. So this is what it is right now. And you could pick your virtual trainer up. If you're testing in July or August, Kathy's testing this week. I'm nervous. Please pray for me, ReMar family. Absolutely, we will. Absolutely, we will. Okay. All right. Yes. All right. So that is it. Okay. All right. So I am going to sign, I know some people are saying, how do I get in touch with you? Please support at remarreview.com. The team answers emails in the order that we receive them. Today is Monday, so the office is closed Saturday and Sunday. Okay, the office is closed. We don't open up on the weekends. So we have a lot to do, okay? And yes, I'll tell Mark hello. I will. All right. So I will see you guys. We're going to do this again next week. And I am looking forward to passing. Okay, Miss B, if you scroll down and if you go to the events page, if you scroll down to the descriptions, the Amazon link is on there, okay? So I sent you guys the event page to sign up for the virtual baby shower. Please sign up for it because I'm going to do a question handout. It'll probably be downloadable. I think I can add files to this page. But I'll send you a question, a file for the virtual baby shower. And then, so we'll play games, on the document that I create. And then also we'll answer NCLEX questions. Okay. And so I think you guys will like it. Okay. All right. So shout out to all the nurses that made it here live. That is the most challenging thing to do. And you made it here for our study session. I will see you guys later. All right. We always end by saying this. You guys know it. It is simply, I can, I will, and I must pass NCLEX. I can, I will, I must pass NCLEX.